So in order to access your patient's chart, obviously we are going to have a list of names here. Like I said earlier, I'm not going to have a schedule pulled up just because it is a live web page. So as you can see, we're going to see a patient named Jimmy Test, and we're going to be looking at his chart and going through that. On this page, you can access the reason for the visit, which is located right here. So it looks like he's here for back pain. You can see their age and the time of their appointment and how long that appointment slot was allotted for. So for him, it looks like it's 20 minutes. And you can see this orange bubble bar thing right here by his name. That dictates how far into the check-in process that patient is. So you will see blue when they first arrive, and over here where it says ready for staff, instead of it saying ready for staff, it's actually going to say arrived. That's again when they first check in with our front desk, and then once they're fully checked in and ready to be taken back by the nursing staff, then this is going to turn orange like we see here. So if we click on him, we're going to pretend like he's already ready, and we can go ahead and access his chart. This is his summary page. So on this page, you can access all these things on the left: allergies, problems, their medications. You can kind of get a feel for what they're here for, their kind of history, and just the types of things that they've been on, just to familiarize yourself with that before you actually go into the room with the patient. You can access their old visits here on this visit tab. And if you click on, say we're going to look at his old hospital discharge follow-up. Granted, there's nothing written here, but there would be, say they're here for atrial fibrillation, long-term current use, they're on an anticoagulation therapy like a Coumadin or something. You're going to click on that and you would see those diagnoses there. Let's see if I can find any. Now, usually we delete them afterwards, but so you can find the full visit if you pull over using this little arrow button. Again, this is a blank document, but when you would be seeing your patients, you would have access to all of their reason for a visit, assessment and plan, HPI, all that kind of stuff. You'd have access to their full chart. And then in order to minimize that, you just push the arrow back. And again, you'll probably be looking through and browsing through these side tabs quite a bit. So familiarize yourself with where they're located so you can get a better feel for them while you're in the room. So any values that you would need to see, you would go to this results tab. And you can pull up, see his last A1C, it looks like it was 8.9. So that's going to be where you find those values. If they've had blood work done, say look down here, they've had a basic metabolic panel. If you click on that, you can go through those values. And typically it will say abnormal or normal, low, high range on these blood tests, but sometimes they're unknown, as you can see here, and sometimes they're mislabeled. So sometimes this wouldn't see CBC, it wouldn't say that. If you click on the little squiggly mark next to it, it could be an actual document. And you would know that where it says attachment available. And that way you would just click on the squiggly line and you can look through that actual document that was faxed to us manually. And most of the time though, you're going to be able to see that blood work here really plainly without having to view the attachment. Again, vitals, our nursing staff will obtain those vitals when they're taken back to the room. You won't have to worry about that as a student. You can look at their vaccines and their history, their problem list. These are considered active issues in Athena, but just be careful whenever you're looking at them. Sometimes, obviously, like the laceration of a hand, that could be an active problem or it could not be. So just make sure that you're also referring to that visits tab and seeing what their last visit was and what they're actually here for. So like we said, he's here for back pain. So in order to access the exam, we're going to go to this drop down next to intake and click go to exam. You'll never work in the intake unless you're specifically instructed to, but I would not assume that you're going to be working much in the intake unless you're part of the nursing staff. So this is part of their editable chart. So everything on the left stays the same, so you're still going to be able to access the allergies, meds, results, visits, all that kind of stuff. Everything on the top tab up here is going to be your editing tabs. So first thing that you want to do is make sure that you give this patient a reason for a visit. So it looks like they're having back pain. You're going to click on that plus. And there are these follow-up reasons if they are following up with back pain. It doesn't really matter which one you click, but just be aware that if you click follow up backache or follow up anything reasons, it auto-populates that into the diagnosis section. And we're going to get to that in a little while about being specific with those codes and with those diagnoses. So it's not always the best option because it will auto-populate that. You might not want to say he had a backache. You might want to say he had scoliosis and had secondary pain or something like that. So what I'm trying to say is make sure that you're always checking your diagnoses here in the A&P, but we'll get to that here in a second. So first off, we did the reason, back pain, and that's pretty much the only thing that you're going to be using on this. I know that it's partner applications, intake, all that kind of stuff. You're not going to be using any of that. Really, you're just doing that reason for visit. If you click over, you can either use the next button to go to the next tab, or you can specifically click on the HPI tab. If you have a Mac computer, typically we advise you to use that next button because it tends to save your work better. This is all saved as you go, but sometimes if you have a slow connection and you're using the top tabs just to click and go through it, sometimes that's not saved as well. So either way, your choice, next or then just clicking the tabs will do. So this HPI is where you're going to free text your HPI that you've obtained on the patient. So once you've gone into the room and you've figured out what they're here for, gotten their signs and symptoms, taken a history, you're going to be able to type here in this text box free text. So I would say something like Mr. Test is a 67-year-old male with a history of whatever. And then you go through whatever their histories were that you took, their previous medical history, and that's where you're going to put that. So then we can go over to our next tab, our review of systems. You're also going to be obtaining this in the room with the patient. Typically, we like to use templates instead of free text, but depending on who you're working with, that can change. The template that we use, if you click on that plus next to review systems, you're going to use the adult male brief tab and see how that auto-populates all of these structures. So what I typically advise you to do is to click all normal, and that will automatically open up every symptom that they could or could not have, and that way it helps you see what, it just opens up the template a little bit more. So as you can see here, we have our constitutional. We expect you to take a pretty full review of systems, but not all the time you're gonna have all these checked. If you ever need to uncheck something, say you didn't really ask about weight loss, you just click it once and it goes away. And same with if you want to add a symptom. So say they're having abnormal weight loss. We can click weight loss, and then we can put an estimated pound amount. So probably, let's say he lost 20 pounds or something. If you wanted to describe 20 pounds and say it's been intentional or over a period of time or something like that, you can double click and you can talk about it. So over 2 months. It'd be extreme, but we're going to put that. You can do that with any of these symptoms that you have on these templates. Any template that you pull up in Athena, you can edit just like that. So eye pain, you could say right eye. And if you take an extensive HPI, in terms of, making sure that you go through this and you've asked all these questions in your actual HPI, there's no real need to double it up. So you can click this button. But that's only if you've taken a very extensive HPI. We don't really advise doing that all the time, just because this template helps you when we have the full document. We're able to quicker and easier go over the symptoms and what they were going through. So if you don't want to have an entire section, you can just click this clear button, and that takes off all of those symptoms. So typically we're going to take off breast unless you asked about it, that kind of stuff. So the next tab we're going to use is the physical exam. again, we use a template for this. If you click on that plus mark next to physical exam and go down, we're going to use the same thing, adult male brief. And just notice that you're not going to accidentally click the wrong sex on these. This is a male brief. It automatically populates with the sex of the patient. But just be aware if you use if you customize a template, and one of the other assistants can show you more personally how to customize a template in case you wanted to. You can have either. You could accidentally put a female. So same thing as the review systems. We're going to all normal just so we can see the majority of these questions and findings. So for neurologic, you can see this is pretty extensive. I'm just going to bring to notice there are some tests that come up automatically as a physical exam. So I know that not all physical exams, you won't always do a finger to nose or a normal tandem gait. So just make sure that if you don't do those things that you're unclicking them so it doesn't look like you are. I know that a normal physical exam would be easy just to click all normal, but you want to really make sure that you're going through these and unchecking anything that you did not evaluate. Same with if you didn't do breasts, just do that. So yeah, that's those 3 templates. At this point, you are pretty much done with your portion in the room being alone. After this portion, after obtaining your physical exam, you're likely going to present to your supervisor, so either a doctor or a PA. So once you've completed that and you've presented to them, then you're going to be working in the A&P.